evening, everyone. Today I'm going to talk to you about the role of non-invasive brain stimulation for addiction medicine. And as I thank you for this really kind introduction. We know that addiction is a global health issue with a relevant economic and social impact worldwide. We know that about 21 million of people each year use psychoactive substances, and that's why it's really important for a clinician and for everyone who is involved in addiction medicine to promote strategies for preventing the drug use, but also to develop therapeutic strategies, especially for addiction, where basically we, the majority of time, we don't have medication with a proven efficacy, or more often the side effects are very intolerable. And that's why our group has worked all over these years in brain stimulation studies in order to develop really efficacious and tolerable alternatives for addiction therapy. And this is the outline of my presentation. I'm going to talk a little bit about neurobiology of addiction. Then I will show you the clinical implications of using rTMS for psychoactive using disorder with a specific focus on cocaine use disorder. And then I'm going to show you the data about our studies on long-term follow-up and the clinical outcomes we can use to monitor the results and the clinical course of patients with cocaine use disorder undergoing rTMS stimulation. And then I will drive you to the conclusions. We know that addiction is a brain disorder, and is a brain disorder because we know that for each stage that has been described to explain the development and maintenance of addiction, there is a specific maladaptive change in the reward circuitry, involving also the stress response and the executive function. And all those circuitry abnormalities are basically linked to a disruption in the dopamine signaling. And indeed, we can see that all the neuroimaging studies have allowed us to identify dopamine dysfunction in people using drug of abuse. And as you can see here in this DAT scan, basically people using cocaine or methamphetamine or alcohol, all of those people showed this dysfunction within basal ganglia. And compared to control, people using substance of abuse showed also a reduced activity of the pattern of activity in the frontal areas. And this is really important because this reduced activity in frontal areas involves regions that allows the salience attribution and motivation, and is implicated also in compulsive behavior that is typical for people suffering from addiction. Knowing all these neurocircuitry disruption can lead us to hypotheses or to identify the areas on which we can work to develop therapeutic strategies.